What is Medicare balance billing and how to avoid it? Have you ever received a bill that made you wonder why you owe more than what Medicare covers? That's where Medicare balance billing comes into play. Let's break it down so you can manage your costs better. Medicare balance billing happens when a healthcare provider charges you the difference between their fee and what Medicare approves. For example, if a provider charges $100 for a service, but Medicare only approves $70, the provider may bill you for the remaining $30. However, this practice is generally not allowed for providers who accept Medicare assignment. Providers who accept Medicare assignment agree to accept the Medicare-approved amount as full payment. This means they cannot bill you for the difference. You will only be responsible for the Medicare deductible, co-insurance, or co-payment amounts. Now, what if you see a provider who does not accept Medicare assignment? In this case, they can charge more than what Medicare approves. However, there is a limit to how much they can charge you. This limit is known as the limiting charge, which is typically 15% above the Medicare-approved amount for non-participating providers. There are also protections in place for certain beneficiaries. For example, if you are a dual-eligible beneficiary, meaning you qualify for both Medicare and Medicaid, you cannot be charged for Medicare cost-sharing amounts. This means no copays, co-insurance, or deductibles from your Medicare providers. So, how can you avoid balance billing? First, always choose providers who accept Medicare assignment. This way, you know they will not bill you beyond what Medicare covers. Before receiving services, check if your provider is in Medicare's network or accepts assignment. If you happen to receive a bill that looks like balance billing, you have options. You can file a complaint with Medicare or your state's Medicare balance billing program. It's also wise to review your medical bills carefully. Compare them with Medicare's explanation of benefits to spot any incorrect charges. Understanding balance billing is essential for managing your out-of-pocket expenses under Medicare. By selecting providers who accept Medicare assignment and knowing your rights, you can avoid unexpected bills. If you suspect any improper billing, remember that Medicare has resources and processes to help protect you.